In this video we'll talk about atrial flutter. Atrial flutter is defined as regular atrial activation at a rate of 250 to 330 bpm. However, this rate is relative. Sometimes a typical flutter pattern may be at an atrial rate of 220 bpm. Isthmus-dependent, also called typical, atrial flutter is the most common type. The impulse spreads downward in the right atrial free wall, goes through the cavotricuspid isthmus, and ascends in the atrial septum. The impulse spreads from the atrial septum to the left atrium. So, the mechanism is macro re-entry. Occasionally atrial flutter may arise from the re-entry loops around the superior vena cava, mitral annulus, and pulmonary veins. Atrial flutter produces a sawtooth pattern. In the counterclockwise atrial flutter, negative flutter waves are seen in the inferior leads 2, 3, IVF, and positive waves are seen in lead V1. In the clockwise atrial flutter, the flutter waves are positive and wide in the inferior leads and are often negative in the lead V1. Atrial activations are regular. However, in atrial flutter, ventricular activations are either regular or irregular. The ventricular rate depends on the conduction via the atrioventricular node. Sometimes the atrioventricular node conducts impulses regularly, resulting in a regular ventricular rhythm. In such cases, atrial flutter may be misinterpreted as another kind of supraventricular tachycardia. Often atrial flutter with rapid ventricular response may lead to heart failure and be life-threatening. Valsalva maneuver or beta blockers may worsen the atrioventricular conduction and make flutter waves obvious. Sometimes atrial flutter with a 2-to-1 ventricular response is very difficult to distinguish from sinus tachycardia or other supraventricular tachycardias. Atrial flutter with a 1-to-1 ventricular response is a life-threatening condition resulting from an extremely high ventricular rate. Often bundle branch block occur at a high ventricular rate. It's very difficult to distinguish this condition from the ventricular tachycardia. Valsalva maneuver may lead to short-term worsened atrioventricular conduction and give evidence that the rhythm isn't ventricular tachycardia, atrioventricular nodal reentrant tachycardia and atrioventricular reentrant tachycardia. Vagal maneuvers in case of the atrial flutter may slow down the ventricular response for a short time and make the flutter waves obvious or have no effect on the atrioventricular conduction. When a vagal maneuver is stopped, the previous level of atrioventricular conduction is restored. However, the sinus rhythm cannot be restored by vagal maneuvers during the atrial flutter. Catheter ablation is the preferred method for most patients, especially those with isthmus-dependent atrial flutter. Sinus rhythm can be restored either pharmacologically or via direct current cardioversion. Prior to ablation or restoring the sinus rhythm, ventricular rate control should be performed with beta blockers, digoxin, or calcium channel blockers. Thank you for watching this video. Please like and subscribe.